Welcome to NCLEXMap, the power engine that transforms knowledge into confident action. Today, we're breaking down the 8 domains of the NCLEX Test Plan with real, high-level clinical scenarios that bring each domain to life. Management of care. You're caring for 4 clients. One is newly post-op with unstable vitals. Another needs discharge teaching. One is waiting for a dressing change, and one wants pain medication. Question: who do you see first? Answer: the unstable post-op patient comes first. Prioritize using ABCs, Maslow, and safety principles. Leadership and critical thinking define this domain. Safety and infection control. A client with tuberculosis is placed in a semi-private room because no isolation room is available. The UAP enters wearing only a surgical mask. Question: what's your immediate nursing action? Answer: stop the exposure, remove the UAP, and initiate airborne isolation with an N95 respirator and negative pressure room. Patient and staff safety always come before convenience. Health promotion and maintenance. A 28-year-old pregnant woman tells you she hasn't received any prenatal care because she feels fine. Question: what is the nurse's priority teaching? Answer: educate on the importance of early prenatal visits for fetal development screening and prevention of complications. This domain emphasizes proactive care and prevention, not waiting for illness. Psychosocial integrity. A patient recently diagnosed with cancer says, "I don't want any treatment. I just want to die." Question: how should the nurse respond? Answer: acknowledge their feelings. It sounds like you're feeling overwhelmed. Can you tell me more about what's worrying you most? This tests your therapeutic communication and emotional intelligence. Basic care and comfort. A client on bed rest reports increasing back pain and frustration from immobility. Question: what's the best nursing action? Answer: reposition every 2 hours, provide a pressure-relieving mattress, and encourage range of motion exercises. Comfort measures and dignity define nursing at its core. Pharmacological and parenteral therapies. Your patient with atrial fibrillation is on warfarin. Their INR is 5.2, and they complain of bleeding gums. Question: what is your action? Answer: hold the medication, notify the provider, and assess for bleeding. Safe medication administration means recognizing abnormal lab values and preventing harm before it happens. Reduction of risk potential. A post-operative patient suddenly develops shortness of breath and chest pain. Oxygen saturation drops to 88%. Question: what complication do you suspect, and what is your first action? Answer: suspect pulmonary embolism. Raise the head of bed, apply oxygen, and notify the provider immediately. This domain is about early recognition and prevention of worsening outcomes. Physiological adaptation. A trauma patient arrives hypotensive with cool, clammy skin, weak pulse, and confusion. Question: what should the nurse do first? Answer: initiate rapid IV fluids and support airway and oxygen. Recognize hypovolemic shock and act immediately. This domain tests how you manage life-threatening instability and adapt to changing physiology. Each of these domains is more than just exam categories. They're the framework for safe nursing care. Together, they test your ability to think critically and act decisively. You're not just answering questions, you're proving you're ready to practice safely. Stay confident, stay curious, and remember, NCLEXMap is here to help you transform knowledge into action. Like, share, and subscribe for more insights to sharpen your clinical judgment every day.